Hi, my name is Dr. Ross Hauser. Welcome to the Hauser Neck Center here in Fort Myers, Florida. Here with a special guest, Angela, all the way from Switzerland. Now, we first met in 2017, and what I wanted to do with this video is accomplish three things. One, kind of explain, why you ended up coming here in 2017. And then you and I had a conversation just about how neck problems probably are causing a lot of symptoms, because you're now a doctor of Oriental Medicine, so congratulations on that. Maybe you could explain how you became that, and maybe just talk about some of the things that you're seeing in your own practice in Switzerland.
Okay, well, I'll start with how we met. So first, I had an accident when I was 19 years old, and where I tore my medial meniscus. And I had multiple surgeries, and in the first surgery, they took out my meniscus without asking me, gave it to me.
But now you know that's not a good idea, right?
It's not a good idea. Because afterwards, I couldn't walk for around a year.
Were you an athlete, like just curiosity before that?
I did dancing.
I know, but that's like a lot of...
yeah. I injured it dancing, actually.
Okay.
I did a jump. I jumped wrong and, tore it. And then, anyway, they cleared it out. And then I said, what do I do now? And they said, stay home, don't do a lot of activity and you'll be okay. And I was like, I'm 19. And so it was rough for a few years, and but I could manage. And after 5-6 years, it started swelling up, it started locking. I couldn't go upstairs, I couldn't do anything, I couldn't work, couldn't take the bus, anything. And so at that point, again, I went to surgeons and they told me, okay, you need a prosthetic knee, you need osteotomy to fix the misalignment, And I said, look, I was 25. I was like, my life would stop if I had to go through all those surgeries. So I was pretty desperate. And one of your patients, his mother had come to you also, and she was in a similar situation. But anyway, so he said, come to US and meet Dr. Hauser. And I was desperate, so I was like, yeah, anything. Okay. And so we went, and so we started the journey.
I showed you the instability.
You showed me the instability, and actually no one at the time told me that I was hypermobile. And
yeah.
I remember sitting there like this or something, and you were like, oh, do you have a problem with your neck? Oh, do you have migraines? I'm like, yeah. And you're like, do you know it's not normal to have migraines every day? And I'm like, oh, yeah, that's true. I was like, you were like, oh, it's not normal to have your eyes going like this. I'm like, oh, that's true, it's not normal. So that really changed my view.
Did I treat your neck or no?
You did, but we couldn't follow that.
Okay, so maybe, we'll talk about that. Now, you're just out of curiosity, did the eye thing get better?
The eye thing did get better.
Okay.
The headaches continue, but...
Okay. Well, you probably still have a neck thing, which we're going to check you out later today.
But yes, so as far as the knee, we did multiple treatments for the knee. And now at this point, I can work full time. I mean, I'm with patients all day on my feet. I do cycling 3-4 times a week. I walk all over the city. And I can manage, I have some pain, of course, but I manage the pain, no sharp pain, no locking. And this is after all the treatments that we've done over the years.
That's awesome.
Yeah, no one believes in the clinic where I work that I have
was your health problems, was that what led you to go be a doctor of Oriental Medicine?
Yes, I was...
I know, so see, there could be a silver lining, because I always think you're better off going to a doctor that's been a patient, because you have a certain level of compassion for those in pain and disabled because you've experienced it.
Well, it started with my injury. I studied psychology, actually, so I did 5 years of that. And then after I wanted to continue to treat myself, I still had knee problems, pain, and I went to a Chinese medicine practitioner in Hong Kong. And he taught me a little bit about how to treat my pain and so on. So then I was like, wow, amazing compliment. So I moved to China to study Chinese medicine.
And you said it took 5 years.
Yeah, 5 years. So.
Now, we've had, in the last 24 hours, we've been talking about some of the symptoms that you're seeing that you feel like a lot of your patients actually have structural neck issues. So why don't you explain that? Like what are some of the things you're seeing in your practice?
Okay, well, I see a lot of pain patients and a lot of...
Was that the number one thing you see?
I would say at least 50%.
And you probably see a lot of fatigue?
It's pain, mental health. I would say that's one of the big ones for me.
When you say mental health, what do you mean?
Anxiety, depression, PTSD, eating disorders, things like that.
Okay.
But a lot of those also have pain, of course, and very interlinked. So But yes, a lot of pain patients, and they come and they tell me they have migraines. They tell me that they've been to neurologists, they've been to all types of doctors, and they give them antidepressants. That's all they can do for their pain. For example, I have a patient, she's an esthetician, so she's always looking down like that. She has chronic migraines, she has problems with her eyes, she has foggy brain, just tinnitus, an array of symptoms. And she said, I've been everywhere and no one can do anything. So she says she takes sick leave and she cries all day and she doesn't know what to do. And so, of course, with acupuncture and so on, I can't change the hypomobile neck, but I teach her about what's happening.
You can affect the nervous system amazingly. Like, I think that's one of the major effects. I know they talk about chi and this or that, but anytime I've had acupuncture, it's unbelievable. In the midst of getting treated, you can just see that all of a sudden you change the parasympathetic dominance, right? The person comes in sympathetic dominance, and then there's just a point during the treatment where all of a sudden, boom.
Yeah, exactly.
Like the body relaxes, the body can heal.
Exactly. That's first you educate the patient of what's going on, and of course you will ask them to change their habits and how they're working. Their pillow, I give the list of
Perfect,
pillow. So they have all that. And then besides that, yes, we work on the parasympathetic nervous system. We relax the muscles, the knots. We help the blood flow to the brain, the oxygen. And their vision does change over a course of treatment, and the migraines go down. Of course, it is temporary in some of their cases because they do have hypomobile necks, and they have to continue to come once in a while for the treatment. But the symptoms drastically decrease with our approach, using your approach actually for hypermobility of the neck. So
Patrick was your significant other. He was talking about migraines and he said the neurologists in Switzerland, because you're both practicing in Switzerland, that they just won't acknowledge that there could be a neck component to the...
Yeah, they focus on the different types of migraines,
like medicines. They're experts at, you have this kind of migraine, so this kind of medicine.
Exactly, and they say tension headaches is the one thing that could sort of correlate with the neck instability, but otherwise they never check the neck.
I don't know if you get involved with this too is... Well, let me ask you this. Your clients, is the average person... their jobs, are they working on the computer? Yes. Like in the States, I'd say it's more likely than not when somebody comes in and they're working, their job involves a lot of computer.
That's the first question I ask them.
And would you say that the average person you see also, they do seem to be addicted to their cell phone?
That too. I usually go, first of all, I ask them to change how they're on their phone, because the majority are going to be like this. And of course their computer, you talk about that. You ask them to change how they work on the computer. Sometimes I ask them to take a photo so we can evaluate that. But some of the patients I've had talking about those symptoms besides the esthetician was just secretaries. You're working on the computer all day. And they were saying they were having a hard time seeing the screen after a while and so on. They thought they were going crazy. So it's a lot about educating.
Like if we went to a medical conference and you and I said that depression, anxiety, even some personality disorders or obsessive compulsive disorder, it seems like from the clinician's point of view that the person's was raised in a stressful family, or they're just born that way. I'm just going to I wanted us to talk about clues that there may be a neck structural issue with it. And I think one of the clues is, and we had talked a little bit about it this morning, is when something changes. Like if you're 22 and all of a sudden you're more afraid or you're more anxious, like it changed.
Of course.
Like you weren't a 16-year-old teenager that you were worried all the time. Something majorly changed. It means that something changed in your body. And the thing that makes the most amount of sense is, probably your neck structure changed. Like all of a sudden your vagus nerves are getting compressed, or your jugular veins are getting compressed, so then your brain can't drain. But what are some other things you might look at that this is a neck problem versus, like, post-traumatic stress disorder? You and I would say, well, there was a major stress, or the person was in the Iraq war, or their marriage, they had a breakup, they had a divorce. So what would what are some clues that you look for that it may be a neck problem?
Do you mean if they've had those?
Well, no, if somebody has a symptom like of anxiety or migraine or they have dizziness, and you're thinking like, do they have cervicogenic dizziness? Do they have cervicogenic vertigo? Do they have cervicogenic causes of their eye symptoms? Like, what are some things that you might look at in the history or?
Yeah, that they've had some type of trauma, like for example, and of course whiplash, the typical trauma, fall, if they have history of doing high impact sports, I guess, fallen from the bed, things like that. Of course, you go into
if they're hypermobile, you talk about
genetically too. If they have other joints that are hypermobile, so you would ask that.
Many years ago, before I was an expert in ligamentous problems, with my migraine headache patients, I'd ask them, one is, do you normally have neck pain? That's one. And then two is, before your migraine, do you feel like there's tension in your neck, then you get a migraine? And it's amazing how many people will say, wow, that's interesting, you should say that. I think you're correct. I think, in other words, the day before I'm having all this tension in my neck, then at nighttime I have this like horrible, horrible migraine. And then I think a lot of people don't realize your neck's not supposed to crack. Like my neck doesn't crack. So somebody and if people don't realize, like, every time you crack yourself, you're actually getting yourself looser and looser.
Well, I think what's interesting too is that a lot of patients are just used to having tension and pain. And just like I was when someone's asked me, is it normal to have headaches every day? So when I ask the patient, do you have neck pain? A lot of them will say no. And then I go into the other symptoms. Okay, do you have tinnitus, this, that, da-da-da? And then you'll be like, oh, okay. And they're like, well, actually, I do have some headaches or tension here and there. So it's incredible how we've learned in this modern age to live with that type of neck symptoms. And
have you heard of the phrase Occam's razor? Have you ever heard? Okay. So, back in the 1500s or 1600s, there's this monk, and he just came up with this theorem that the simplest solution is normally the correct one. Because, if you think about, that's another point I just wanted us to make was, it's likely the more symptoms you have, it's more likely it probably is a neck problem. And the reason being is the epicenter of the body, the epicenter of the body that controls, like if we're going to say that acupuncture dramatically affects the nervous system, which it does, but the epicenter of the nervous system is right at the cranial cervical junction, right? Because the vagus nerve ganglion are right there, and then the sympathetic ganglion are there. So the sympathetic system and the parasympathetic system, the ganglion are all right here, and then everything that goes into the brain, all the nerves that go into the brain or out of the brain, all the fluid that goes into the brain, out of the brain, that has to go through the highway. And then if you said, what's the weak link in the neck? It's going to be at the atlas, right? Because the most mobile part of the human body, maybe beside the shoulder, you would say is the atlas. So that area, especially if you've hit your head on something, or you have Ehlers-Danlos or genetically hypermobility, that's probably the area that's going to break down, and that's the area you need to get scanned. So, and then in Europe, as you know, they don't really have a lot of digital motion x-rays or this or that. So
the only way you can really diagnose is through symptom analysis and checking a bit manually, but that's about it. Or in some x-rays, I guess, open mouth, perhaps you can see a little bit, but otherwise that's it.
So you love being a doctor?
I love it.
You seem like you have the right personality for it, like you love people.
I love people, yeah.
And then because you've gotten help too, I think that makes you have an advantage of being a doctor.
Yeah, well, I think I really, first of all, for myself too, always trying to solve puzzles, solve what I can do.
That's good.
And then on top of that, really helping, I really care because I know what it feels like to be in pain.
Okay, so I'm just going to switch gears just a little bit. So why don't we talk about, because you are going to get assessed today, so why don't we just talk about what are some symptoms that you have or you think might be related to your neck?
Well, of course, pain, headaches,
Neck pain.
constant headaches, pretty constant,
Okay.
yeah. Sometimes eye symptoms, blurry vision, foggy brain, tinnitus, high-pitched tinnitus that changes with movement.
Oh, that's
nausea.
another clue. If you move your neck in a symptom, or you lay down and your symptom gets better, that actually could be the neck too. Because when you lay down, of course, your jugular veins open.
Supporting it.
Okay.
And then sometimes I get some nerve compression in the face. I've been to dentists sometimes because I thought I had a cavity, and they're like, no.
Yeah.
So yeah, I was just, and also I guess jaw too. I have some instability, so jaw, neck, everything. Yeah, those are the main ones.
Digestion.
Digestion. A lot
Like
of
what?
issues.
What symptoms?
Like type of gastritis, nausea, sometimes constipation, which no one can understand why.
Do you have to be really careful with what you eat?
Yeah, I have
Okay.
to be very
I think that's another clue too. Like, I'm not saying that everybody should eat junk and eat everything, but you shouldn't have to just eat 10 foods, or you have one piece of bread, and you get some crazy reaction.
Spicy food, gluten,
Okay.
any type of heavy food. Yeah, that's.
Okay. What about heart?
Yes, I get palpitations
Okay.
often.
Have you had a heart exam? Like, have you had an echo? Have you had
No, I've never had an
okay.
echo. No.
Okay. When you get tested today, if Karina has time, just ask her. Just say that you should just get an echo.
Okay.
Just because you're hypermobile, and
Yeah.
just make sure the valves are good. And
Yeah, I've heard that I should do that, but
Okay.
I also had just chest pain sometimes.
Okay.
But, yeah.
Okay. Fullness in the ears, or any
Yeah.
changes of hearing?
Yeah.
Okay, so you actually have the gamut.
Yeah.
You're like cervical instability. You could be the
I've
model
everything.
for cervical
when I read
instability.
your articles, I'm like, wow.
Yeah.
That's me. But yeah, and I did often have issues with anxiety. Like, I've had panic attacks, which didn't come from any particular origin. So that was interesting too.
A change, like you had a
Change.
change. So that I think that's the key thing.
Actually, once I was studying university, and I was constantly hovered over, and I started realizing I was having more like
Okay.
strong palpitations and anxiety. So if it was structural or not, I wasn't sure about.